like yesterday, since the start of yesterday,
Right.
my decision making's been like better.
Really?
And I feel like also like choosing things to do, because I'm like, I don't have that much energy, so I gotta like choose
monitor
like,
what you do and how you expend your energy, right?
exactly, yeah. And like even like things that don't require much energy but also like, I don't know, are better for you, like instead of like choosing to like scroll and just look at, you know, whatever is on social media for a little bit, I'm like, no, I should probably like fold the clothes or something like that. So it's been better with that side of things, but we'll see. I mean, it's barely day 3, and we'll see how I feel tomorrow.
I think it's awesome. I really like fasting. I feel like it's a way to kind of dig deep into, you know, it's like that carnal desire, carnal part of us that you know, we set aside, and it truly is a good way to kind of reposition ourselves, right? To kind of reposition our mind, our you know, wants and desires, set those things aside, and really figure out exactly what we want. You know, you were mentioning to me earlier about the fact that you were having to really decide, you know, what you do with your energy, and when we're full of food and we aren't worried about that, we kind of just do a lot of times just whatever. But it's good to refocus and redirect our minds, and so that's awesome. I can't wait to hear what your thoughts are when it's all over, and see what, you know, the outcome is, right?
Yeah.
And so, so that it's.
How was your week?
Oh, my week, it was good. It was just, you know, working, lots of surgeries and cases during the week, which always is great. My daughter Elsa had a volleyball tournament, which we spent the weekend playing she was playing volleyball. I was watching, so nice. It's fun. It's fun to watch. She's 14 and 15 now.
15,
gosh. 15 going on 21, but it's fun to watch her interact with her teammates, and she's really a leader. Like, she gets the girls all fired up, and when they're not doing so great, she pumps them up to get them, you know, which I think is an important skill to learn how to do, right? When things are kind of down, you got to lift yourself up and lift everybody around you up. So other than that, it's been a great week.
That's awesome.
Yeah, we had a patient, and this patient's they're so amazing, and they've been my patients for a long time. This is my good friends and patients they actually live up in Napa Valley in Healdsburg, actually, and Dorothy and John, they are just incredible people. And a little while ago, John passed away, and they would come down from Healdsburg, from Napa Valley to Newport Beach religiously, like every 6 months they would come down, and then, you know, I got the news that John had passed away, and you just really start to think, and my heart goes out to Dorothy, because she truly is just an amazing person. She actually teaches Spanish. She has a PhD in Spanish, I believe, or a master's, I think. So just the sweetest people, amazing people, and so I got to thinking, you know, after and they were together all the time, like they were just totally united, and you know, I had done both of their mouths, and, you know, it's like, and I saw Dorothy probably a month ago, and could just sense and feel the loss in her. But what I noticed was she still had that fight. Like, she was still like, you know what, I'm sad, this is hard, but she's still fighting, you know. And I loved that about, you know, I just loved to see that. And, you know, whatever I can do to help and support. But, you know, we all go through these things. We all have losses. I remember when my dad died, I felt the same way. I felt like my world had collapsed, you know. But we gotta get up and keep fighting. And so, you know, they are just incredible people. I know she's going to be just fine, but it's so hard to lose a loved one that means so much to us, you know. So, anyway, so let's look at some cases. Got a lot of really nice cases to look at here. So, again, we kind of go back to that the aesthetics, the prosthetics, the materials, the process, biomechanics, implant placement, more than 4, always. And because in the end, what matters most are these relationships and how we approach them, right? We want to approach life with as much vigor, like Elsa on her volleyball team, who, played 8 games and lost 6 of them, but still having that vigor, still having that, we got this, we can do this. It's not easy. It's a grind, but we want to attack life with the very most, like you are right now with fasting, attacking life with the most precise, the best decisions, and the best approach possible. And, excuse me, and oftentimes, when we have patients, like we talked about last week on our live stream, when we have patients that, and I use the metaphor of, when the mouth is kind of broken down and we feel self-conscious, we feel we feel like we're not approaching life at the very best approach possible, or we have some sort of a handicap. And patients that are losing, missing, or lost their teeth, they're really approaching it with a handicap because they're obstructing their smile, they're trying to hide their smile. They know subconsciously, even though maybe the world around them doesn't really pay that much attention to it. But it's a very big thing for the patient. They're kind of handicapped, I would say, in that sense. So, once it's restored, and they're living with this handicap, they've lived with it for quite a while. But once restored, that problem is now gone. It's not an issue anymore. And you can see it in these photos. You can see, here. I mean, this guy is amazing as well. He's an avid mountain biker. He's actually a physician, and just the nicest guy. He's like, I just want to get my mouth fixed. He had kind of put everybody else first, his family, and everybody else came first, and then finally he decided, I'm going to get my mouth fixed. So. And you can see it in this photo versus, this photo here. Complete transformation. That problem or handicap that he had at that point is now gone. And that's one thing that we can fix, right? We can solve that. We can, that's something we can handle. There's certain handicaps we cannot fix. And so, but the things that we can fix, whether it's physical, like our teeth or whatever the case may be. Sometimes it can be a mental handicap, but anytime that we can do things like you're doing, Memo, fasting, to try to reorient ourselves, to put ourselves in a place where better mental clarity, because I've heard that this 72-hour fast really does give you more mental clarity.
Yeah.
Have you noticed that at all?
Yeah, definitely. Yeah. And I feel like clarity, and like we mentioned, like making decisions, even just talking, just kind of, you don't feel like the same energy. So you are even careful with the things that you want to say, or right? Like,
if you feel like you're going to pass out at
no,
not
not at all. But you're just like, okay, should I say that? And then you really think about things twice, which is better, right? Because sometimes, I do it all the time. I say things that later I'm like, maybe I shouldn't have said that, right?
Right.
I feel like we all do so.
Yeah.
It's better now, making decisions like that.
Absolutely, yeah. So, and it takes effort, right? When you decided to start that fast, you're like, okay, this is what I'm going to do, and you had to wake up that morning, and you didn't eat, and then lunch you didn't eat, dinner you didn't eat, so, and then the next day same thing, and it's a conscious decision that you're having to make every single day, and to stick with it, have a goal. Like before we started the live stream, you mentioned, in the literature it says 48 hours is enough, right? And you said that at 48 you're like, well, maybe I'm good, right? But you set a goal. You're like, I'm doing 72, so you're going for it.
Yeah.
And which is amazing. So
thank you.
Yeah, no. So yeah, just the restoration of some sort of a handicap, whatever that may be. Oftentimes it is our smile, it is our mouth, it is the way we feel about ourselves, which is something that can be restored. Situations like this where we've got lots of stuff going on. Patient's been very self-conscious about his smile for a long time. He works in a bank. He's very successful, but it was a handicap that had been kind of inhibiting him and obstructing his full potential for quite a while. And so, after we restored everything, got him back together, his confidence went through the roof. And this is what I love about what I do, is I see it all the time. As soon as it's a process to get there, but once completed, it's a transformation. It's a complete transformation, and it gives that patient so much confidence after it's all done.
Well, going along with Dr. Willerson, we really encourage people to go and watch our testimonials, because there are actual patients. There's all these other places out there, like corporate, all on 4 places, and some of them literally say right there, like, paid actor, right? So, and they're great at acting. They say what you want to hear,
right?
But our patients are just, they sign something. They
absolutely
want to be filmed, and they're telling the truth. And if you watch all our testimonials, they're all so happy, so grateful that they did the procedure. So,
yeah, for sure. And I would say we're a smaller operation, but that allows me to control things. There's a lot of bigger corporate practices, all on 4 centers out there. They have their approach, but ours is very, like with the couple that I showed in the beginning. I've known them since I think probably 2004, and they've been consistently coming to see me. Not that they need work all the time, because we did their case many, many years ago. John, actually, the husband, I did his case about 3 years ago, but because he was more focused on Dorothy, wanting her situated, and which is how he was. He was very much, everything was about his wife, put her first in all things. But this is a classic example of the relationships that we have here in our practice. Once a patient signs up with us and they're part of our network and basically our family, we go to whatever lengths to get them squared away and situated. And so, which is just the way that I approach these, every case. So,
yeah.
Again, another situation very similar. You can see all kinds of stuff going on, and this is an example of a case where we tend to outlive our teeth. We just do. Our teeth are very strong and resilient, but our bite, and I say this a lot on my live streams and on YouTube, but our bite, the musculature in our face, the masseter muscles are so much stronger than the dentition themselves or the teeth themselves. And so in time, the teeth will break down. They'll start to break down, and they will eventually, a lot of times, have to be removed. And so I do have a close-up shot, but I don't want to bore you guys with all these before and afters. But again, transformation of his aura, of how he's presenting himself. And actually, he wasn't all that concerned about the aesthetics here. Like it wasn't his primary concern, but he did want his bite and ability to chew corrected. So,
awesome.
But the aesthetics is just a beautiful part of the process. Of course, it's going to look amazing when it's done, but restoring that integrity, restoring the biomechanics and the functionality of his mouth is an important part of all of us, right?
Yeah. I do want to read our first comment, Dr. Willerson, and this actually ties to what we were planning on talking about for the rest of the live stream, which is perfect. So I'm going to go ahead and read it, and then we can get into it. It's from Andrew Smith, and it says, "This channel is great. A big reason I got my real estate license in August was to make enough money to fix my dental situation. So congratulations on getting your real estate license." It says, give me a year, and I should be a patient. I've been abducting since 12. Obstructing since 12, sorry. And yeah, like that's awesome. And someone asked, where do you live? And he's saying Oregon, Bend, Oregon. So this is what we were going to talk about in the live stream, right? Yeah. Exciting news for all of our viewers that live in other states. We are actually, what do you call it?
We've established an entity, Trust Implant Partners and Trust Implants Partners, and we are expanding into, other cities. So we're moving into, we will be in Portland, Oregon. Bend, I'm not sure how far Bend is from Portland, but it's probably a 2-hour drive. So we're trying to get in every major city so that patients have access to the Trust Implant Doctors Network and the techniques and processes that we offer that I know are superior to, it's just the most ideal, superior way to manage and treat, maintain, and support patients who are in situations like this. And we will not do the cookie cutter procedures. We will provide the patients with the most ideal treatment and materials and prosthetics available today. So, but yes, we are excited to be coming into cities around the country, very, very soon. And so,
and I kind of want to explain a little bit more about that, because we're not just gonna create a practice. We're meeting and multiple times with specific doctors in those areas that can do these.
We're selective about the doctors.
Exactly, that are going to take on the name of Trust Implants, are going to be partners and can do these same procedures. So yeah, Dane, you want to talk a little bit more about that?
Oh, sure. Yeah, so just Dr. Willardson can't be everywhere at once, but there are a lot of people that you can. There's amazing doctors across the country. And so the idea is to connect doctors with similar values, similar standards, so that patients, in Washington, D.C., Florida, all over the country can receive the same treatment. Because all the time we have on YouTube and Instagram and everything, oh man, I live in, Cincinnati, or I live in Michigan. And so it would be quite a hassle to come out to California to get the procedure done. And so this provides patients with like-minded doctors, similar processes, similar values that can receive the same level of treatment. And so we want to connect all those doctors, and so it makes it a lot more accessible for the patients.
Yeah, which, we do have patients that come from all over the country, and it's going to be a process. Because it's very important that we find the right practitioners to match the patients. And to be part of the network, we want to have practitioners that are malleable, that are willing to kind of adapt their practice, and so that this is going to, I liken it to like an arc, and all of the, whether it's patients or doctors that are on this arc, we want to provide the most effective, safest, efficient, and long-term results possible. And so and that's where we are in the process of selecting and providing, having partners of Trust Implant Partners that are able to provide the same sort of service. And there's plenty of doctors out there that are willing and able to do that. And then it's just a matter of matching those doctors with the patients that are able to do the procedure and have the procedure done.
Well, it was like Memo talked about earlier, the paid actors, how on a lot of commercials, so
we don't have any paid actors.
Yeah, in fact, patients offer, I'd love to be in a video, shoot my testimonial, I want as many people to hear about this as possible.
We have the greatest patients.
I
would just say that.
And so I think it's hard for people to discern between someone like the corporate dentists who are paying people to, give these beautiful testimonials, but it's because that's their profession, it's they're actors. So how does a patient discern between the two is the difficult process. And so what this network of doctors does is you have the stamp of approval saying, these are trust level doctors. And of course, like you said, there are a lot of people that fly. A lot of our patients come from out of state. But that's not possible for everyone.
Yeah, absolutely.
Especially considering the fact that it requires multiple appointments from start to finish. So having to come from out of state on multiple occasions might not be, whether it's for work or financial reasons. There's a lot of reasons why that's impossible for some people. So this then, provides that opportunity for those who it might be a little more challenging.
Yeah, I mean, it's an exciting time for us here at Trust Implants. We are, growing a lot, and with that comes some growing pains, but those are good things. I just have been, all of us have been very passionate about, taking this message, providing the service, and kind of breaking through what, I'd say 99% of the implant centers are doing, which, the all-on-4 is a great procedure, but there's so many different ways to approach each patient. And like I've said 1,000 times, I cannot put every patient in the same box. I have to look at them because, actually, let me show a case. My screen's off here. So here's a patient who, and if you look at her photos of her teeth, you kind of look at them, you think, what's wrong? I mean, there's nothing really wrong here, right? I mean, there's some old crowns and, some stuff going on, needs a cleaning and that sort of thing. Some abfractions are up at the root here. An abfraction is when you clench your teeth and that the cervical margin where the gum and the enamel meet, the dentin, because it's softer, and the load factors, when you clench down, it starts to chip away the dentin and sometimes the enamel at that junction, so right in here. So very common, and I only say that, I'm not trying to use big words, but very common in older patients, and especially in patients who clench, brux, or grind their teeth. And so you'll see these like kind of moon-shaped halos or abfractions at the top of each root, and I've seen them where they get so bad where it ditches all the way into the nerve of the tooth. Somebody who really has a strong bite or clenches really hard. So anyways, just, you wouldn't think that's a big deal, but it can break down the tooth or the mouth. So, but and unfortunately I had to reboot my iCat and I lost a ton of images, or otherwise I would show the images. But in her CT scan, the bone is very mottled, and there's actually mottled meaning there's there's some holes in her bone, and at the apex of 80% of these teeth were lesions, apical lesions or infection. And I was kind of shocked because in looking at her teeth and looking at her mouth, it doesn't look like she's even a candidate for implants, right? But as I dug deeper, and she had called me, well, I saw her as a consult, and then I didn't see her again for probably 6 or 8 months. And she called me, she's like, I have multiple areas where like pus is coming out of my teeth, or out of the gum. And so anyways, after further investigation and determination, like, wow, you know what? All of these teeth have to come out, every single one of them. And I was kind of shocked because, again, looking at this x-ray, you would think, these teeth look fine, but there was, and I think it has to do with the bruxism or clenching, and so over time the load factors and the load factors were completely off. Like when she was only hitting in a few areas, but the destruction of the bone had gotten so far that she had to have all of her teeth removed. And so here she is pre-op, or when we were actually going under to extract everything. Again, you look at this photo, you think, well, what's wrong with her teeth? There's nothing wrong with them, but they all had to come out, which I didn't want to do that. I did not want to extract her teeth. But the only reason I bring this up is because I had to tailor a treatment plan specifically for her. Had I just done that cookie cutter, extract all your teeth, put in 4 implants, 4 on the upper, 4 on the lower, all on 4 process, that would have failed as well because of her parafunctional habits, which is clenching, grinding, and we all have them. Sometimes in our sleep, we grind or clench. Sometimes during the day, if we're stressed, we grind or clench. But especially patients who have an imbalance in their how their mouth functions, and again, I say biomechanics, how the teeth articulate. If there's one area that's hitting first subconsciously in your mind, you're going to grind that tooth down until the rest of the teeth touch. That's just our inherent desire, right? And so anyways, long story short, this is a case completed. And you can see we restored it. We put in 10 implants in the maxilla, 8 or 10 in the mandible or lower jaw, I'm not sure. But I put in a sufficient number of implants. My technique of extracting the teeth, grafting, and placing implants was very methodical. I wanted to restore her case with implants, knowing all these teeth had to come out, as close to her natural dentition and teeth as possible. And so that was not going, I couldn't do that with an all-on-4 because the prosthesis in an all-on-4 is so bulky and big, and it just won't feel like natural teeth. So in her case, I had to put a sufficient number of implants in an ideal position so that in the end I have a prosthesis that will mimic and match what she's lost, which is her natural teeth. Because it's really, really hard to go from what we call dentate, or having teeth, to edentulous, which is no teeth. Again, that's kind of my worst fear, is to lose all of my teeth. So anyway, so again, a very classic case of somebody who had to be approached very methodically, very strategically, so that the end result would be an ideal situation.
And that's a good leeway into another question that we've got in the comments from Kimberly Morris. Excuse me. She said, how many dental issues can you fix in one procedure? I have missing bone and teeth along with some gum recession.
That's a good question, Kimberly. So usually, I mean, when I go in, I try to resolve and fix as many issues as I possibly can for that situation. Oftentimes, let's say the patient's missing a lot of bone and I'm unable to place the implant because I need to regenerate that bone and build it up. So the graft in the bone has to heal before I can place an implant. But there are many times, like in this case here, where I can extract, graft, and implant at the same time. Again, very specific and custom tailored to not just the patient, but to that site. I've said it before, but I'll have a surgery where I'm placing 8 or more implants. I have to treat each implant site individually. So, an implant on the lower right is very different than an implant in the upper front, and like in 8 and 9, the two centrals. My approach is very different. In fact, I've got many patients, but when I have to extract, graft, and implant like a front tooth, 8 or 9, the two like a central, that's an expensive implant because I got to do a lot of work to make that tooth look like it's a natural tooth, because the goal is to make it look natural and not just getting an implant. And so versus a lower molar where it's aesthetically is not as critical, but still important because it has to take on that load. And so I have to approach each implant site, each patient, each site, and each outcome completely different. I have to approach it according to the needs of the patient at that time. Like for Kimberly, if she has recession around some teeth, some bone loss, I've got to treat the recession, I got to treat the bone loss, and then I have to restore it to natural aesthetics and function. And so my approach for that situation is tailored in the moment for them at that time, Because the other thing is, in 6 months, I had a case of consult the other day. He's like, yeah, I think I'm going to wait 6 months. I'm like, well, 6 months, everything could change, In fact, I started a case in July, but she, for whatever reason, hasn't scheduled until now, and it's December. And we've had to add treatment because 2 of the teeth that we were planning on doing one thing now have to be implants. So time is very important. Timing is important. The approach that I take is really important. So these are all things that have to be considered.
So on average, would you say those things are fixed of course they're fixed from point A to point Z in the whole process, but it might require multiple appointments to fix all of them?
Yeah, sorry, I didn't even answer Kimberly's question. It was, oftentimes I can fix it in the same appointment, and I do try to do that as much as possible because I want to streamline the case as well. I want to try to get the patient completed as quickly as I can, but while still delivering long-term, functional aesthetic results.
Right.
So I will do everything in my power on that first stage to correct as many of those issues as I can for that situation.
Right. And because I know, especially with bone, that bone has to heal.
Yeah.
And so when you do bone grafts and everything, you can't place the implant until that bone is dense enough and has enough structure to support the load. So it requires time to heal as well. But
yeah, for sure. So the rule of thumb there is, like, let's say I pull out a tooth and then I have a defect of around. So let's say I've lost, the bone on this side of the tooth, but this bone is still good. I've got bone here and here, but my like the facial wall or the front side of the tooth or implant is exposed. The bone is exposed. Even then, a lot of times I can place the implant, and I have a technique that I use in order to predictably regenerate that bone on the front side of the implant. And so I'll place the implant, graft everywhere around it, graft the buccal or the facial side of the bone, put a membrane. So anyways, a lot of technical information there. But there, I approach each site according to my knowledge and ability to know this is going to work. If it's not going to work, I don't do it.
Mm-hmm. It's like, you remember the Chia Pets back in the day on the infomercial?
Yes.
You put the bone in and it's going to grow where...
That's right. It does. I mean, that's, again, I go back to, it's amazing to me how, I ask the body to do something. Not I do, but...
You direct the operation a little bit.
I direct by surgically manipulating tissues, bone, and I'm always in awe at how it responds and heals. It's pretty remarkable.
That's awesome. And thank you for the questions, by the way, Kimberly and Andrew.
Yes, absolutely. Again, if you have questions, please. That's another reason why we're here is to answer those questions.
Yeah, we have one more from Andrew, but I wanted to comment when you get into it and you explain what you have to do. It reminds me of, I don't know if you've seen, it's like a football player getting interviewed and they're like, tell us what happened in that last play. And he could tell the play like he was there again. And everyone, like, you see the comments, right? And like even the commentary, they're like, wow, like this is why you're a professional, right? Because you study film and like you can even remember the plays exactly how they played out. And so it just kind of reminded me of that, right? Like, I mean, you're a practitioner. You've been doing this for so long that you can like do these things in your mind. So that's why we're providing this, the same techniques that Dr. Wilson uses to cities around the country.
I think it's important. I know it's important in my gut. I know it's critically important to make this available to as many patients and qualified practitioners, and that's going to be a critical aspect, is finding practitioners that have the skill set already, that they've, you have to be trained under, university-based, bona fide training, doctors. The principles have to be there. But where Trust Implants comes in is we can kind of modernize the principles and the techniques, and also, more importantly, customizing the treatment that's most ideal for every case. And that's where I'll always go back to, is that the treatments that we offer are going to be the very best for you as the patient. Some patients, that's not for them. They just want their teeth out. They want all on four. They want a hybrid plastic teeth and good to go. It's the cheapest solution. I mean, there's no way I can financially compete with some of these all on four centers, because a plastic prosthesis versus zirconia, the way that we do our zirconia is completely different. The costs are very different. Yeah. But if we go back to, I don't know if it was last week's live stream or the week before, but in looking at, where is it? Some of the plastic prosthetics. Anyways, a few live streams back, I showed a patient, and I think he had 19 sets of teeth made. And just the time, oh, here it is right here. Just the time back and forth, the headache, because you don't know when this is going to break, right? I mean, you could be at a Christmas office party, who knows what, or you could be at your daughter's wedding. You don't know when this thing's going to break. And so having, I don't care what it's made of, if it's zirconia plastic, hybrid titanium plastic, when it breaks, for me as the doctor, is it a big deal? Yes, it's a big deal for me. But the doctor's at home in bed, but you're at your Christmas dinner party and your prosthesis breaks. That's a huge deal for the patient, and it's a big deal at the time because now they're like stuck. They have no choice. They have to get the thing out of their mouth because it's cutting their lip, they're biting their cheek, whatever. And what do they do at this point? So again, we have to go back to, what is the most ideal material and treatment for the patient so that we can avoid these sort of situations.
Yeah, and just not knowing when it's going to end.
Exactly.
Like, you're okay, I go back, I get another prosthesis in, 3 weeks, 6 months? Like, you don't know, right? You could be, I don't know, doing whatever. Going back to our comments, so we have 2 more comments from our same viewer, Andrew. He said, what's the appropriate time frame for the approximate time frame for the Portland location?
So we're actively working on practice in Portland right now. So send us your information, Andrew, in a DM, and we will keep you updated on when we can get you referred up to the Portland doctor up in. He's actually in Portland, Oregon. So, but if you'll send us your information, we'll get that to you ASAP.
Awesome. Thank you. And then the last one from him as well. Thanks for answering. Definitely keep making this content. You're the best, most transparent dental channel out there. And that's our goal here with this channel. We want to educate patients. We want to help them out, help them not go through what we always show, what we see here almost every day, right? Patients that got treatment done in Mexico or all-on-4. And like Dr. Willerson says, the all-on-4 procedure is not bad, but it's not a one size fits all for everyone.
Right.
In some scenarios it does work, right?
Mm-hmm.
For some people, but these all-on-4 corporate centers don't tell you that. They just want to get you in and get you out.
Yeah.
Right. So,
and that's really what it is. It's it's kind of an in and out procedure, and it's pretty tough to have relationships with the patients like this if and this is just one example of many, but I truly feel like these are my family, and the loss of her husband, I feel it deep inside of me. I mean, he was a wonderful guy, and she's a wonderful friend and patient, and that's what you get at Trust Implants. Like, it's not, if let's say for example, I had done an all-on-4 on either one of John or Dorothy, and I had this chronic prosthetic complication that all-on-4s have, and the prosthesis kept breaking and breaking and breaking, and they're traveling back and forth from, Healdsburg is about 8 hours from Newport Beach, so whether they fly or drive or whatever, I can't imagine the complications, or the relationship would be tarnished. Yeah. There's just no way we can have such a tender, good, familial type relationship if I'm not delivering the very best aesthetic, functional materials, prosthetic, surgical results possible. And that's, we have that with our patients. We have that kind of familial connection, and I treat them like I would treat my son, my mother, my brother. Like, I want the very, very best for every single one of my patients. And of course, every dentist or doctor is going to say that, right? That's just kind of but I truly feel like, well, first of all, I would never do an all-on-4 on pretty much anybody, but certainly, if they, their cases were very different. They did have multiple implants in multiple areas, and actually their cases, they're front teeth implants. So the stakes were very high for me. Aesthetics were very, very important. my approach, the surgical approach to placement of these implants was very methodical and very important. And so I could have an outcome to where, you know, they're smiling like this. And so, and it's really difficult to get that level of care in a corporate situation because everything's based on the numbers and how many cases are being done and how many, you know, when you have venture capital money backing you and billions of dollars at stake, there's no time for real connection, you know. Mm-hmm. There's just not time for it. And it's a turn and burn situation, and they can do it a lot cheaper. I mean, I've seen as low as about maybe $35,000 for a full mouth, you know, upper and lower extractions, grafts, implants, and of course that's a plastic prosthesis. But, you know, the numbers are important, and we do provide a service for amazing value, but we don't base everything off of just doing the same procedure at one price. And I would never advertise one price because I can't put every patient in the same box, you know.
Yeah, and then every surgery could take 6 hours or 8 hours, you know, or like people could come for 2 different appointments, right? So
right.
You have to consider all that because there's so much that goes into it, right, with like everything else.
Yeah, absolutely.
And I want to add that, you know, you've been seeing the fact that you know them personally speaks volumes about the difference between someone like trust and a corporate office, because, you know, we've done a lot of research into the industry of corporate dentistry with private equity and everything to get the whole trust implant partners rolling. And excuse me, on average, the practitioner stays at a corporate office 9 months.
Mm-hmm.
That's the average lifespan of a practitioner at these offices. So by the time you start and finish, it could be a different doctor that's finishing you, that doesn't understand the treatment plan that was originally written, or, you know, and I'm sure they've got technology in place to have it be somewhat streamlined. But the point is, we've had, the story of one of your first cases that we saw 20-some years later, same implants, she looked amazing, her teeth were still in place, and that was you, and you were just a little hatchling out of school. And so I don't even know if I was born yet when you finished that case.
Actually, you were born that year. It was in 1999 is when I started the case.
Yeah, which is crazy, because she still came back, found you, and it was you. You know what I mean? So that's also a level of value that is not talked about, that it's you and it will always be you here. So it provides a lot of value for someone to have a personal relationship with their patients. Yeah.
Yeah, for sure. Especially when you're talking about an investment, right? I mean, it's not a inexpensive procedure. I mean, we're talking about the cost of, you know, oftentimes, but I don't want to get hung up on the cost so much as I want to look at the value. We've shown a lot of photos of cases before and afters, and the transformation that exists with them, you know, when they go from situations like, let's see here, and we'll show his post-operative video. But, you know, when we have these transformations where the patient at one point is handicapped, so to speak, with their smile, self-confidence, mastication, ability to chew and eat, and then all of a sudden that problem has now been restored, or that handicap is now restored, it's really hard to put a price tag on that. And again, approaching each case individually so we get the very most ideal outcome and long-term result, it's hard to get hung up on the price. And again, I know, because I give a very good value for what we deliver on the outcome, on the end result. And that is what allows me to sleep at night, you know.
Yeah. Yeah, and it's also interesting to think about, the value is the important aspect here. It's not the price tag, because 25 plus years of zero problems, 25 years down the road, if you were able to feel the stresses and the problems that come with paying 35 versus 55, day one, you might say, yeah, 35, it's a lot cheaper. It makes a lot more sense. But 25 years down the road, when you've had zero
5
issues.
years down the road.
Yeah,
10
5
years down the road.
Then at that point, you would say, oh, I should have paid 50. Do you know what I mean? And so we see patients all the time.
Actually, what happens is they will pay 50 because they'll pay 40 or 35, and then a few years later, when the prosthesis fails, they're going to have to pay again. So they're going to pay another 25 or 30 or $40,000. So it's the beginning of the process of spending a lot of money on your mouth. If you don't invest wisely from the beginning, you will invest a lot of money, or you'll spend a lot of money over time, because it has not been over-engineered. There's not enough or sufficient number of implants. And so eventually you're going to spend more money because, again, we showed some cases where we outlive our teeth. The musculature in our face and our mouth and our chewing is so incredibly strong that you've got to engineer the case to withstand that, you know. I was listening to Michael Saylor, he's a big Bitcoin guy, and he's like, you know, why would you know, you can build a ship out of taco shells if you want. It'll, you know, in theory you can build a ship out of taco shells, but would you get on that ship and try to cross the, you know, the Great Sea? Right. I mean, and the other one, he's like, you can build a ship out of cotton candy. He's like, you know, of course that's silly, but. And not that the all-on-4 is that, but it has limitations, and the materials that the resin-wrapped hybrid is made of is kind of like building a ship out of, I don't know, maybe plywood, 2-ply plywood. You know, it's just, and we want to engineer something that is not that. That's very strong and resilient.
Yeah. It'll float, but eventually it gets waterlogged and.
Right.
You know, it's a wave storm. There's $100 surfboard.
Any wave that comes in is just going to destroy the thing, you know. So
Costco's got a $100 surfboard. It's called the Wave Storms. That notoriously you use a wave storm and shore break waves because it's going to snap. And you take it back in fully snapped, and Costco hands you a new one. You don't buy a wave storm so that you can surf on it for the rest of your life. You buy a wave storm because it's cheap and you can take it. You know, you don't really care about it.
Right.
And so it's a similar situation where you're not. If you pay $1,000 for a longboard, it's going to last you a lifetime. But you pay $100 for a wave storm and 1 or 2 bad waves, and that thing is.
And that's a great analogy, because how much does a wave storm cost Costco?
Oh, probably $5.
$5, $10. So it's $100, and I think they're like $119. So you pay $120 for a wave storm surfboard, but they have built into their cost the fact that it's going to probably break, and so they're okay with when it breaks, you bring it in and you get a new one, right? They don't even, and I mean, I've never even obviously thought of that, but that's similar to the plastic hybrid all-on-4. It's so cheaply made that, you know, and they say, well, in fact, the case that I showed you with all those broken bridges, that was their deal. If it breaks, we'll just make you a new one. Not considering the fact that he could be at his daughter's wedding and the thing breaks, or he could be on a date or something and the thing breaks, you know, out with his wife for their anniversary and it breaks. Like you just never know when it's going to break or how it's going to break, and they don't factor that into the equation of this is a human being, this is somebody who, you know, they want this problem handicap solved and be done with it. Not that, if it breaks, come in and we'll make you a new set of teeth. You know, that's. We try to factor that breakage part out of the equation and to minimize the inherent life-affecting complications that come along with, you know, once you get it done, you want it to be done and be done with it. So.
Yeah, and it goes back to a principle. I mean, like you talked about earlier, I'm studying finance, so everything, unfortunately, I tie it back to finance. So I got to get a new hobby.
That's a good thing.
I need a new hobby, but. In finance, everything is valued, including the factor of time. It's called the time value of money is a very basic principle in finance. So spending money, $1 today is worth more than $1 in the future. And so with that same logic, getting it done right today is a lot more valuable than getting it done right in 10 years, because you'll have 10 extra years of enjoyment, of ease, and that you will not enjoy if you were to skip out or take the different corporate route. There's costs that you are taking on without even realizing it by missing out on that period of time where it could have been fully solved. And then also going back this might be going back a little too far, but in the corporate offices, you know, you talked about the profit. It's all about the bottom line. It's the NOI. That's what every corporate, anything with finance and money wants to look for, is a higher NOI. How do I get my NOI higher? And that's why they use cheap parts, because the same procedure, they can turn out the same number of patients, but their overhead's way lower. And not only that, when you're backed by giant private equity companies, one dental office is it's a grain of rice compared to what they're dealing with. Like,
That's right.
they've got billions and billions
one
of
patient
dollars.
is like a grain of sand. It's just
Yeah.
you're nothing to that system, right?
The system that corporate dentistry builds does not take into consideration as much as
The
it should
human
the
factor.
individual and human factor of each and every patient.
That's
And
a
so,
great point. Never even thought about that. That is truly the case.
right, terms and